Hey, I'm Chris the Chu, and we are the Cribsiders. We are the pediatric medicine podcast where we interview leading experts to bring you clinical pearls, practice-changing knowledge, and answering linking questions about core topics in pediatric medicine.
Interest. I'm Justin Burke, and today we're doing a recap on an episode we've recorded with Dr. Joshua Sharfstein. Dr. Sharfstein is a public health expert at the national level. He is the author of a book, Public Health Crisis Survival Guide, a book we all need now, host of the podcast On Call Public Health. It was former Secretary of the Maryland Department of Health and the former Deputy Commissioner of the U.S. FDA. The episode we're talking about today is on back to school, on the K through 12 reopenings. One of the major things in going back to school that has to be assessed is the fact that there are benefits and there are risks to going back to school. There are definitely obvious benefits in that this is helpful for intellectual development of children, helpful for social development of children. They need friends. It can be a way to help feed children for the free and reduced meal programs at a lot of schools. And unfortunately, it's a great way to help keep kids safe. The unfortunate part is that 1 in 5 abuse reports does come through schools and teachers. And so without having schools, we can worry that there might be an increase of incidents in child abuse.
But remember, there aren't just benefits, there are obviously risks, and these are the issues that everyone's talking about. So we'll have to talk more than just benefits because the risks are what everyone's worried about. We have to talk about risk mitigation and risk reduction. So just remember, it's not risk avoidance because that's really, frankly, impossible to do. So in terms of risk mitigation, we have to look at what risks we have. So what we do know is that risk may be associated with age. So those who are less than 10 years of age may have a lower risk of transmissibility, may be more asymptomatic. But as children become older, their ability to possibly transmit virus may be much higher. So those are things to keep in mind.
Yeah, and we talked about a few different risk mitigation strategies. One is the idea of having pods or classrooms that are followed in groups where if anyone were to get sick, it would be very easy to do contact tracing to quarantine specific groups to help reduce transmission. And we've seen some of these strategies put into place in other countries. So Germany, Norway, Denmark, and Israel have all had school reopenings with some success. Most started with conservative measures that proved to be successful. Israel was an example that Dr. Sharfstein pointed out where some of the risk mitigation strategies were relaxed, and then they ultimately did have to close schools because of outbreaks. We've already seen some states reopen and have to close, and a lot of the issue is going to be based on the community rates. One of the things I took away from the discussion with Dr. Sharfstein is the biggest risk factor is the community rates. And if we want to make kids able to go back to school safely, it's reducing this community spread and the community transmission of COVID.
One important thing that I also got out of our discussion was the fact that not going back to school really exacerbates our health disparities. It is children who are in the underserved communities who are at higher risk for having these exacerbations. These are children who have poor Wi-Fi or inconsistent internet access. So really, we have to keep those things in mind because really it's our children, the next generation, who are sacrificing if they don't go back to school.
The other important population that we talked about is the teachers. We have to protect the teachers and we have to make sure that they feel safe going back. No school system can send teachers back without the appropriate protective gear, the appropriate PPE. This is just the same crisis we saw early on with healthcare workers. Dr. Sharfstein made a great point about the Baltimore City school system, where just last winter they had an issue with schools losing their heat. When teachers fought and advocated to get heaters back into the classroom, the response may have been slower than they anticipated. We may have lost a lot of credibility with teachers. So it wouldn't be unfounded if they're skeptical to say everything's in place, ready to have a safe return.
I really hope everyone checks out our full episode with Dr. Joshua Sharfstein. It can be found at our website, www.thecribsiders.com. And you can send us an email at thecribsiders@gmail.com. Thanks so much for listening.